Welcome to aminacademy.com. In questions, how, why, and what. Regarding that, let us ask this question. What is pregnancy? How does it happen? What are the problems on pregnancy? Pregnancy refers to a time when you have a fetus or more than one developing in your uterus. It most often happen after sexual intercourse, but it can also happen through assisted reproductive technologies, that is ART. At and at home, pregnancy test is the most common way to confirm pregnancy, but you can also confirm you are pregnant with a blood test. Some of the first sign of pregnancy include a missed period, nausea, and fatigue. Most pregnancies can end in a live birth, either a vaginal delivery or a C-section. Some pregnancy end in miscarriage, abortion, or stillbirth. How does pregnancy happen? Pregnancy is a complex process consisting of several steps, but it all starts with an egg and sperm. Eggs live in ovaries. Each menstrual cycle, mother's ovary releases an egg. The egg slowly travels through your fallopian tube where it waits for sperm. This process, which is called ovulation, take about 12 to 24 hours. Sperm comes from testicles. When a person ejaculates, they releases millions of sperm from their penis. During sexual intercourses, sperm travels through your vagina and up to your fallopian tubes. For pregnancy to happen, a sperm or egg need to meet and come together. That is conception. The sperm fertilizes the egg in a process called fertilization. The now fertilized egg travels down your fallopian tube where it divides into more and more cells, forming a collection of cells called a blastocyst. Blastocyst. After about 3 days, the blastocyst gets to your uterus. At this point, the blastocyst can implant into your uterus, a step called implantation, where it's now an embryo. The placenta begins to form after implantation. The embryo changes once more to become a fetus, which is the term your provide may use until your baby's birth. Once implantation happens, your body releases pregnancy hormones to prevent your from getting your period. These same hormones also help with fetal development. What is assisted reproductive technology? ART. The process occurs the same way with ART, but some of the steps happen outside of your body. The stars of the show are still the sperms and eggs, but instead of conception occurring naturally or by chance. Your healthcare provider helps by making it slightly easier for them to come together. Here's now some of the more common ARTs work. Intrauterine insemination, IUI. Your healthcare provider places sperm directly into your uterus using a catheter. IUI occurs at the time of ovulation. Some people take fertility medication to increase their chance of ovulation. In vitro fertilization (IVF), your healthcare provider combines the egg and sperm in a lab to create an embryo. Then they place the embryo inside your uterus. Your healthcare provider may give you several different types of medications during an IVF cycle. This helps them control the process and improve your chances of a successful pregnancy. How many weeks is a pregnancy? Pregnancy is 40 weeks or 280 days, but it's slightly more complex and harder to understand than that, mostly due to how you calculate as a pregnancy. Your healthcare provider typically determine how far along a pregnancy you are based on the date of your last menstrual period, that is LMP. This gets confusing because ovulation does not happen until about 2 weeks into your cycle. So, by the time you take a pregnancy test 2 weeks after ovulation you are already 4 weeks pregnant. Try not to let a math of pregnancy confuse you. Your pregnancy care provider can help explain it to you and tell you your due date based on a pregnancy ultrasound. If you get pregnant through IVF, the weeks is pregnancy are still the same, but your provider may calculate it differently. This is mainly because they transfer the embryo into your uterus and you are removing some of the steps that take about 2 weeks in a natural conception. What does the gestational age mean? Gestational age basically means how far along the pregnancy is. Gestational age is also confusing because it goes by your LMP, which means it's counting the days before you are pregnant. It is essentially occurs for the time before ovulation when your body is preparing for a pregnancy. Now let us discuss further about what is pregnancy, how does it happen, what are the problems on pregnancy. Pregnancy is when a fetus develops in a woman's uterus, usually after sexual intercourse. It typically lasts about 40 weeks or just over 9 months from the first day of the last menstrual period to deliver. Here are some of things to know about pregnancy. Sign and symptoms. Early sign of pregnancy include a missed period, nausea, fatigue, breast tenderness, mood swings, constipation, and weight gain or loss. Other symptoms include back pain, pelvic girdle pain, and increased urinary frequency. Trimester. Trimesters. Health care providers divide pregnancy into three trimesters. Due date. The due date is a guide, and babies usually come when they are ready. A full term baby can be born anytime between 37 to 42 weeks. Confirming pregnancy. A pregnancy test can confirm pregnancy by detecting the presence of human chorionic gonadotropin, that is HCG, is a woman's urine or blood. Prenatal care. It's important to get proper prenatal care as soon as possible. This can include lifestyle changes like taking prenatal vitamins, abstaining from alcohol, and optimizing your diet. Complications. Some maternal complications of pregnancy include toxemia, diabetes mellitus, placenta previa, ectopic pregnancy, hydatidiform moles, septic pregnancy, and maternal hemorrhage. Hemorrhage. How does pregnancy occur? Pregnancy occurs when a sperm fertilizes an egg into the fertilized egg implants in the uterus. Steps in pregnancy. First step, sperm transport. Sperm swim into cervix and can survive in the mucus for up to 5 days. Egg transport. During ovulation, an egg is released and covered in sticky stills that help the fallopian tube catch it. Fertilization. The sperm and egg meet in the fallopian tube and the sperm fertilizes the egg. Embryo development. The fertilized egg divides into and travel to the uterus. Implantation. The fertilized egg implants in the uterine lining and begins to grow. Factors that affect pregnancy. What are the factors to affect the pregnancy? Ovulation. The time of ovulation can vary from woman to woman. Sperm survival. Sperm can survive in the fallopian tubes for up to a week after sex. Multiple eggs. In more than one egg is released during ovulation and fertilized, it can lead to a multiple pregnancy. Implantation. Not every fertilized egg implants in the uterine lining. So far we discussed little about what is pregnancy and how it happened. We have done. Please subscribe our YouTube channel.